Hello, everyone. I am here with my two colleagues, Vena Standard and Stephanie Devane Johnson. We are excited to have an opportunity to present our program to you with the hopes that we can transform this program into something that would also be beneficial for La Comunidad Latina also. So we're going to start with a presentation, an overview of what we have done, and then we're going to open the floor for questions so that we can then see what we can do to help your community. So thank you very much for this time, and sit back and then hopefully jump in just a few minutes. So our program is called LEAD, and LEAD stands for Lived Experience Accessible Doula. I'm not sure if everybody here knows what a doula is, but I just want to give a little background to that. A doula is someone who provides support, both psychological and physical support during labor. This is not a person who is licensed. They can be certified, but this is not a person that takes the place of the midwife or physician or nurse. This is somebody who works alongside with the goal of offering support and advocacy for the birthing person and the family. So Martina's just talked a lot about fathers, and certainly doulas also support dads. We support the family as a unit all together. So that is what a doula is. And now I want to tell you a little bit about our beginnings of our program. So, let's see. Before we get too far into this, we want to thank Dr. Rosa Gonzalez Guarda for this opportunity to come here. She connected us with Latin 19, and I work with Rosa here at the School of Nursing. So thank you, Rosa. Just wanted to put a plug in and tell you how much we appreciate you. So when we began this project, and many of you may be aware of some of the statistics that exist in terms of disparities of birth outcomes for people of color, most specifically for Black women, that Black women who labor and birth are more likely, in terms of numbers, 3 to 4 times more likely to die in childbirth than similarly positioned white women. And so this is something that certainly to the three of us who identify as Black was very scary and difficult to really kind of wrap our heads around. All three of us are also nurse midwives and have worked in the birthing space for altogether more than 60 years. And so this is something that really hit home very near and dear to our heart for many, many reasons. So when you look at the line here, you can actually see a visual of how much more significant birth outcomes, terrible birth outcomes are for people who look like us. When we get even closer to home and we look at North Carolina, the March of Dimes does an annual report and grades states on their birth outcomes and things that contribute to birth outcomes. And as you can see here, North Carolina rates a D. And I'm an educator, and even if I weren't an educator, I know that a D is not what we want to do. And I want to specifically note, when we think about La Comunidad Latina, the rates of preterm birth are higher than white women and white birthing persons, and that specifically may resonate within this community. And so when we think about outcomes related to preterm birth, they're going to be things that affect finances, that affect the ability to work, that affect the family unit, that affect growth and development, that are all related to premature birth. So even within La Comunidad Latina, the outcomes for birth, when we are not offering the best services and that families are not receiving the best care, impacts you as well. So what we do know in terms of solutions, of things that we can do, because according to the CDC, most of the outcomes that are not good in childbirth can be prevented, and up to 80% is the estimate. So most births and most poor outcomes can be changed. One of the things that we know that we can do is think about providing care that is concordant and racially and culturally concordant. Definitely makes a difference. And what we know in terms of benefits of concordant care, and this is something that's been proven in the literature, is that the ability for the person receiving the care to provide information to the provider that is critical to improve and change outcomes is more likely to occur when they are with a person who shares the same identity and culture. So that information giving and exchange is more likely to happen when there's concordant care. When we think about client participation and shared decision-making, which is a big part of care, we know our bodies better than any healthcare care provider ever will, that is more likely to happen when there's concordant care. and also things that are nuanced, nonverbal behaviors, and things like that that really make the difference in terms of communicating between a person receiving care and their provider is much improved when it's concordant care. So these are facts. These are not feelings. These are facts. The other fact, as I'm sure everyone in this room knows, is that many of our providers do not share our identities and they do not look like us. And so we do have an opportunity within the doula service and in the doula space to build a cadre of individuals who can go out and stand in that gap and bridge that difference and offer the care of concordant care, even when our providers and our nurses and our physicians and our midwives do not share our identity. So with that, I'm going to turn it over to my colleague, Stephanie, to talk a little bit about our mission.
Thank you, Jacqui. So thank you again for welcoming us into your space. So when Venus, Jacqui, and I came together for this project and developing this vision that we had, we wanted to increase access and remove financial barriers for doula services for marginalized populations. Our doulas are professionally trained and culturally concordant, meaning the first arm that we have, our doulas are self-identify as Black or African American, so that we can pair them up with Black families, African American families. And so our mission or goal, what we want to do this time, is to train Latina doulas to pair up with Latina families. By increasing this access and removing the financial barriers to doula training, we improve birth outcomes while supporting our doulas in developing a sustainable prenatal business. So in our curriculum, we not only do the emotional and physical support for our families, training for our doulas, but we also teach them how to do business plans so that they can eventually go out and have their own business after they've had their 3 qualifying births with DONA, which is Doulas of North America. That's the certifying body. And then they can charge, have their own business, get a name, and start bringing in more income for their families. Mm-hmm. Our vision is, in the strength of this program lies in the experience and diversity of the team. The instructors are experts in a variety of prenatal specialties. We train with an equity lens, ensuring all aspects of our program are culturally significant and appropriate. So with our Black African American arm, we searched the country. We have wide nets and found experts in all areas of the unique African American or Black lived experience and history. So these are some of the programs and media outlets and articles that have been written about our program. So you've talked to Jacqui. Jacqui has spoken. She's at Duke. I'm at Vanderbilt, and Venus is at UNC Chapel Hill. And so the 3 of us, again, came together to develop this program and to develop this curriculum. And so this is our team. And as you can see, because it's the African American Black arm, all of the trainers and experts are African American and Black. And so our vision for the Hispanic Latina arm is to replicate and do the exact same thing and have Latina experts in their own field and right to do the trainings for the Latina doulas for the Latina mothers and families. And I'll turn it over to Venus now.
Good afternoon. My name is Venus Standard, and as like Stephanie said and Jacqui said, I am at the School of Medicine in USC in Chapel Hill. Can we advance the slide a little bit to the next one? Okay, there you go. So in regards to our program and how we've developed it and put it together, with all of the people that you see, like Stephanie said, they are doing their specialty within the maternal space. And we teach the doulas what they do and how they do it and why is it important to success at the end of the pregnancy. We go through a variety of different things, but to start with, we have to get the doulas. The doulas have found us. We have yet to have to advertise and promote ourselves to find the doulas. And over the last 2 years, we started in 2021, we have had to date 406 applications. We do 2 different trainings a year. So fall and spring, we're getting ready to go into the fall, and that would be our cohort number 6. There's all good intentions on having 20 doulas per cohort, but I really emphasize the requirements and the dedication that is needed to be a doula. Right now, it's very posh and it's very the new thing to do, but some people don't realize the dedication and the hours that are involved in being a doula. So we do a lot of screening to make sure it's a right fit, it's right for them, it's right for their family, and for their working, how they feed their family, what they do for work, things like that. We could take into account all of those things. So out of the 406 applications, now mind you, that 406 also includes people that are trying to get into cohort 6. I think it's about maybe 65 of the applications are for cohort 6. So out of the applications so far, we have done 5 cohorts, and everything is in person. We have a total of 65 doulas that have been trained so far. Out of the 65 doulas, 61 actually completed the program. The program is an 8-weekend concentrated program, Friday, Saturday, and some Sundays. And we do it over 8 weeks. And out of the 65, there has been 61 that actually qualified for certification. Out of the 61 that qualified, 55 have submitted for certification, and out of the ones that have submitted, 46 so far have been certified. Excuse me. And there's 9 that are pending certification. Next slide. Out as a result of our work at UNC Chapel Hill, UNC Chapel Hill has a doula program. They have a volunteer doula program, which is 90, and I don't know the exact percentage, but I would jump out and say 95 to 98% white. So that doesn't lead for a concordant care for somebody who is African American. So our team coming on in the summer, the first cohort finished June of 21. So they were up and ready and rolling in the hospitals July of 21. And from that point to December, the percentage of satisfaction of the patients had increased 20% from 53, I believe it's 53 point something to 74%. We were recognized in US News and World Report, and it gave UNC Chapel Hill the honor of being the best hospital for maternity care for low complicated births. And it cited us in there and it said our name, that we were cited as one of the reasons for the increase in the satisfaction rate and for the outcomes that UNC has received. Next slide. So of our births, Stephanie had mentioned that qualifying births, the word qualifying. So Donor International is the certifying body, is the largest certifying organization in the country. And they require each doula to have 3 qualifying births. And qualifying is you labored with that person, you were there for the delivery, and you stayed for the postpartum period. So sometimes you run into a room and you get there and the baby's already delivered. So that birth would not count. They would actually need another birth. So we had a target with 3 births per doula at the 65. We had a target of 195 patients to serve. We actually served 288. Now that 288 births is a lot, seems a lot it wasn't everybody needed more births, is that the doulas were so vested in the program that they wanted to do more births than just their 3 qualifying. 1, it was because they came to support the community, and 2, it gave them more experience for the business that they were trying to start and the community they were trying to serve. So getting more births was of benefit to them. Of that, I'm gonna go back for 1 second and just talk about the births for a second. Nationally, the births have a C-section rate, I believe, is 30.1%. Of those 288 births, we had 205 vaginal births and 86 C-sections. Of the 86 C-sections, 25 were planned. They were either repeat C-sections, twins, or something that had required the section to be scheduled. So essentially, of our 288 births, we only had 58 that were unscheduled, which is approximately 21% of a percentage of C-section rates based on the births that we attended. The national rate is, I believe, 30.1, and North Carolina's rate is like 29.9 or something really close to 30. So without doulas being there, and it has been proven that doulas decrease the rate of C-sections by 28%. That's been proven in the literature years ago and documented by ACOG, that to decrease your risk of having a C-section would be to have a doula as a part of your team. And our numbers prove it. Having 288 births with only 58 unplanned C-sections, it's only about 20%, excuse me. Of the patients and clients that we have talked to after the birth, 91%, and actually I believe it's a little higher, has rated our doulas as being a good reason why their birth outcome was what it was. They've talked about how it improved their perception, how it helped them know what to expect, because oftentimes patients are overlooked and not put in the center of the case, of the situation. They're put outside the case and things are decided for them. With the doula helps them have a voice. One said that a doula should be mandatory, and it should. And in some places that, doulas are almost at every birth. And somebody also said all families should have a doula. Next slide. And I'm gonna turn it back over to Jacqui.
Okay, so certainly we're excited about the outcomes of our program and what we've been able to do within our community. But our mission is to transform the birth experience for all marginalized people. So it's not just for people that look like us. And so one of the things that's fundamental about having a program like this and having it be successful is making sure that that concordant piece is there. So it would be impossible for us to develop a program for the La Comunidad Latina without La Comunidad Latina. And so we are here to really begin the process of really developing a program like this for your community to improve outcomes. Your birth outcomes are not as dire as the Black community, but issues around access and attending prenatal care and being actively involved in that prenatal care is definitely an issue within La Comunidad Latina. So we want to help make a difference in that. And in order to do that, we need you. And so as we are here today, we want to take our remaining time to begin to understand the unique needs and stories that exist within your community and begin to think about what a group of trainers would look like that would particularly serve your community. And that matters. We picked the trainers that we picked. There are 18 that are involved within our training program, but they're based on the needs of our community, which may look the same, but they may look different within your community. We want to understand that. And we also want to think about where we would go to train the doulas, because again, that concordant piece is key. And so thinking about the places where we might recruit and who we might recruit that would make the biggest impact on your families would be important. And our goal ultimately, as you could see, that many or most, and our goal is that all of our doulas who complete our program are certified through DONA. DONA is the only certifying program that exists within North America. And that's important because when we think about sustainability and the ability for these doulas to work and be paid, reimbursement is a big part of that. And in order to achieve reimbursement for most insurance companies, and we only have one right now in the state of North Carolina that is reimbursing doulas, but as that begins to come into play, certification is likely to be a requirement. So ensuring that the doulas who complete the program are able to be certified and creating a process by which they have births that will allow them to be able to do that and also support their families is key. So that's one of the things that happens. So funding is going to be important, absolutely. But if we can begin to formulate a curriculum and begin to develop our team, and what our dream team looks like within La Comunidad Latina is going to be pivotal to our success. And that's what we are hoping. So the first two parts of our plan is what we need to try to address somewhat today. And this will be an ongoing process to really understand what the needs and stories are. So we hope that you all will share today so we can talk about that. And then beginning to think about the kinds of trainers. And even if you think about it after we talk today, we have our contact information a few slides down. You can send it to us and we will reach out to them and see how we can form a dream team for La Comunidad Latina. Okay. So given that, two questions I want to first put out and open up the floor. And I think Gabrielle brings up a great point. I know that when I was learning to talk with patients, I introduced myself as La Patera, and I don't know if that's appropriate, but changing the name, all of those things, everything is on the table because we only know our experience, and we submit to our ignorance and want to be able to be educated about what your needs are. So please correct, edit, tell us everything. We want to hear it. So is our plan feasible? And what recommendations do you make in terms of modifying our program? We cover things in our program that include wellness, that mindfulness. We talk about business plans. We talk about reproductive health. We talk about the history of medical mistreatment, specifically to Black people. But there are absolutely examples of how the Latino community has been mistreated in the medical system, to give people a reference for why there's mistrust. Because we also recognize that our doulas are gatekeepers to the community. And if we can offer, just as you all have with your lay workers that are here within this organization, we can make sure they are armed to the teeth with all the information that is needed about safe pregnancy and choice, then we have an extension of the healthcare arm to make sure that everyone is getting what they need to come to visits, to get the most out of visits and be educated. So I'm going to put that out there as the questions, but we can go anywhere you like in the next 17 minutes. So with that, I will open the floor, and Rosa, if you'll help me moderate, then Venus and Steffi and I are here. So let's